Right, so I'd like to talk a little bit about resilience, which I think is a fascinating topic and one which we don't address often in the practice of medicine. It is almost a given that the medical practitioner needs to be resilient, and I'm not even sure that we as a profession understand what that is, and I can assure you I don't understand why precisely we need to be resilient. And I'll make a small deal with you. If you keep watching and listening to what I have to say, if it sounds like nonsense, you have to agree to disregard anything I would say, because I don't regard myself as a particularly resilient person. I think I'm on a journey, and I think that one day I perhaps will be a resilient person. And when I get there, I don't even know if I'm going to necessarily, at that point, be able to provide people advice on resilience, because I suspect in this, everyone's got to take their own journey. And so I suppose the first place to start is why is it that we feel that we need to be resilient? Why is it that we feel that we're going to be challenged and threatened and going to need to show some backbone, some resilience in the face of that? And I think that there are a couple of different reasons. The two which jump uppermost in my mind is that the job we do is difficult. I think we have to accept that. I think we have to accept that the practice of clinical medicine is difficult. It's a hard job to do. And in fact, that underpins some of the pride I have in the work that I do. I believe that it's a difficult job to do. We have to accept that we're not going to get good at this job quickly. Getting to a place where we are clinically competent, where we know what we're doing, and we can, with confidence, treat patients well, is a very long journey. And from the moment we begin our training, there are always people who you can look up to, who always appear to be eminently competent. And that causes a lot of discomfort and a lot of doubting of ourselves right from the outset. I have numerous examples of where I've gone home of an evening thinking, I'm never going to get there. I'm never going to be that good. I'm never going to be able to do what I just watched that person do today. And so I think that we need to be resilient in the face of a difficult job that is going to take a long time to learn. I think the other reason, obvious reason, why we need resilience is that we're going to be working with human beings. And what we would love to do from the very first day is to be able to present to them a confident face of somebody who's going to be able to care for them. I would love to walk up to every patient I meet, shake them by the hand, look them in the eye, and know that they would be confident in my capacity to look after them. To give them faith that I'm going to do the correct thing. And while confidence can be portrayed, sometimes it's a hell of a lot more difficult to feel that confidence, because we are intimately aware of our own flaws and our own limitations. And it's difficult to own that. And it's even more difficult to know how much we should own up to that, to our patients. Because we want them to have confidence in us. And part of the therapeutic relationship is going to be to instill confidence in them that we can care for them. I strongly believe that resilience is a journey. It's not something that you're able to develop quickly or easily. And I suppose the easiest way to sort of think through the process of developing resilience is that we will work and live in a very challenging environment. There will be many challenges that we will have to meet. Some of those will challenge us on a deeply personal level, and these are the ones that are going to be most valuable in developing resistance. They're going to be the toughest things that happen to us, but they will be the most powerful developers of resilience through our entire careers. And it's in the presence of these personal challenges that you are forced to take a look at yourself, a good hard look at yourself. And in order to be resilient, you need to be able to look at yourself and say to yourself, I like what I see. Not because what you see is perfect. If you look at yourself and say, I like what I see because it is perfect, you're either terribly delusional or narcissistic, and neither of those are good things. You need to be able to say, I like what I see despite the many, many imperfections. And I say many thinking of myself in particular. You also have to say, I like what I see, because you know that you're concentrating on that which is most important. You're developing yourself in areas that are most important. And I think that in medicine, in clinical medicine, the most important is compassion. Sometimes in my job, it is enough that I really, really care. Sometimes clinical skill, diagnostic acumen, therapeutic interventional success pale into insignificance next to the fact that I really, really care about what happens to the human being and human beings sitting in front of me. The problem with that is that that's a really vulnerable place to look into, and it's a really vulnerable position to be in if you really are carefully looking at yourself and asking yourself whether you like what you see. Even me sitting here talking to a video camera in my office on the back end of Friday afternoon is a fairly vulnerable place, because I'm kind of bearing my soul and exposing myself to ridicule. But that's okay, because I like what I see. And I know that I'm working all the time on making what I see better. And that's going to help me become, in time, a person of resilience. I would also say that there's some things which you can allow not to matter. Senior colleagues shouting at you, junior colleagues or peers of your own competing with you, these things are not important. And in time, you can allow that truth to be known to yourself. I would say that we should be very careful about measuring ourselves against things that we can't change, and measuring ourselves against things that we are able to learn at some time. And so thinking carefully is it actually that important that you missed a cannula, or couldn't get a drain in, or didn't pick a diagnosis, when you can learn and improve and get better? Is it important that a senior member of staff shouted at you? No, it really isn't. It says much more about them than it does of you. And if it was me, I'm really sorry. Is it important that you care about your patient? Is it important that you care about how you interact with other people in the clinical environment? Absolutely.